Hello, welcome to my student support system. In today's class, we will discuss the muscular system part 2, in which we will cover muscles of head and neck. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel my student support system. So here in head and neck, first muscle is Occipito Frontalis. For all the muscles, skeletal muscles, we will discuss main four parts: from where it originates, where it inserts, and what is the function when it contracts, and which nerves supply it, or innervated by which nerve. Or in other words, we can say this muscle is controlled by this nerve. So this we will discuss for each muscle. So first muscle is Occipito Frontalis. This muscle have one central aponeurosis. I have already told you that flat tendon is aponeurosis. So here in the center there is aponeurosis which is attached here on the skull, cranium. So this muscle is having central aponeurosis. It is also known as epicranial aponeurosis that attaches to the central part of cranium and have two muscular bellies. One is anterior and one is posterior. Anterior belly attaches to the skin superior to the supraorbital margin here, and it raises the eyebrow in this way and wrinkles the forehead. In the same way, posterior belly, here this is aponeurosis and this is frontal or anterior belly, and this is posterior or occipital belly. So posterior belly attaches to the occipital bone here and to mastoid process of temporal bone also, and it draws the scalp posteriorly. So this is the Occipito Frontalis muscle. Next muscle is Orbicularis Oris. This muscle surrounds the mouth. Here you can see in this picture. It helps in closing the mouth and protruding the lips. In this way, it also helps in shaping the mouth during speaking. When we are speaking, we are using the Orbicularis Oris muscle. Zygomaticus major. This muscle originates from the zygomatic bone and inserts in the skin at the angle of mouth here. So this is the zygomaticus major, and it also inserts some fibers in the orbicularis oris, and it helps in smiling in this way. Next muscle is zygomaticus minor. So this is anterior to the zygomaticus major. So this is major and this one is minor. Zygomaticus minor originates from the zygomatic bone and inserts in the upper lip. It helps in raising the upper lip and exposing upper teeth. Next muscle is levator levi superioris. This muscle originates from the maxilla below eye, here below the eyeball, levator levi superioris, and insert in the skin at the angle of mouth and orbicularis oris, and it also helps in raising the upper lips. Depressor levi inferioris. This muscle originates from the mandible and inserts in the skin of lower lip. It helps in lowering the lower lip. So here you can see this is Depressor levi inferioris. Depressor Anguli Oris. This muscle originates from the mandible and insert in the skin at the angle of mouth. It helps in opening the mouth and lateral and downward movement of the angle of mouth. So this one is Depressor Anguli Oris. Levator Anguli Oris. This muscle originates from the maxilla and insert in the skin at angle of mouth. So this one is Levator Anguli Oris. And also insert into the Orbicularis Oris. It helps in opening the mouth and smiling. Buccinator. This muscle originates from the maxilla and mandible and insert in the Orbicularis Oris. So here it is Buccinator, this one. It presses the cheek against the teeth in this way and help in sucking, whistling and keeping the food under teeth during chewing. Risorius. This muscle originates from the fascia over parotid gland and insert in the skin at angle of mouth. It draw angle of the mouth laterally as in grimacing. So this one is Risorius. Platysma. This muscle originates from the fascia over deltoid and pectoralis major muscle and insert in the mandible. So this one is the platysma. This is right platysma and this is left platysma. Okay. It helps in depressing the lower jaw and slight downward movement of lower lips. Mentalis. This muscle originates from the mandible and insert in the skin of chin and will help in elevating and protruding the lower lip and elevating the chin, such as in pouting. So this posture is attained by the action of Mentalis. Corrugator Supercelli. This muscle originates from the medial end of superciliary arch of the frontal bone. Here you can see, and insert into the skin under eyebrows. It draws eyebrows inferiorly and wrinkles the skin of the forehead vertically, such as in frowning. Orbicularis oculi. This muscle originates from the medial wall of orbit and take a circular path around the orbit or our eyes. It helps in closing the eyes. All muscles discussed till now. Till now we have discussed 26 muscles. So these all are innervated or supplied by facial nerves, that is seventh cranial nerve. Next one is extraocular muscles. We have 6 pairs of extraocular muscles, 6 for each eye. So these are known as number 1, superior rectus muscle. This muscle originates from common tendinous ring. Here it is attached to the orbit and also known as annulus of Gin, and insert in the superior central part of the eyeball. Here it helps in moving the eyeball upwards. Then inferior rectus. This muscle originates from the common tendinous ring. Again this one, and insert at the inferior central part of the eyeball, and it helps to move the eye downwards. After that, medial rectus. This muscle originates from the common tendinous ring and insert in the medial central part of the eyeball, and it help in moving the eyeball medially in this way. Lateral rectus. This muscle originates from the common tendinous ring and insert at the lateral central part of the eyeball and move the eyeball away from the midline, that is laterally. Superior oblique. Superior oblique muscle, this one. Here you can see, this is superior oblique muscle. This muscle originates from the sphenoid bone and common tendinous ring, and its tendon pass through a trochlea and then insert into the eyeball just above the lateral rectus. It helps to rotate the eyeball medially. Next one is inferior oblique. This muscle originates from the maxilla in the floor of orbit and insert into the eyeball just below lateral rectus. It helps to rotate the eyeball laterally. All the extraocular muscles are innervated by 7th and 4th cranial nerves. Next one is levator palpabrae superioris. This muscle originates from the roof of orbit, this one, and insert into the upper eyelid. It helps in opening the eyes. This muscle is innervated by 3rd cranial nerve. Masseter. This muscle originates from the maxilla and zygomatic arch. Masseter. This is zygomatic arch and maxilla and insert into the mandible, here angle and ramus, and it help in closing the mouth. This muscle is innervated by 5th cranial nerve. Temporalis. This muscle originates from the temporal bone and insert into the coronoid process and ramus of the mandible. It elevates and retracts the mandible. This muscle is innervated by 5th cranial nerve. Medial pterygoid. This muscle originates from the medial surface of lateral portion of pterygoid process of sphenoidal bone and maxilla bone and insert into the angle of mandible and ramus of mandible. It elevates and protrudes the mandible and move it from side to side like this. This muscle is innervated by 5th cranial nerve. Lateral pterygoid. This muscle originates from lateral surface of lateral portion of pterygoid process of sphenoid bone and insert into condyle of mandible. It protracts or protrudes the mandible, depresses the mandible such as in opening the mouth and move it from side to side. This muscle is also innervated by 5th cranial nerve. Genioclosus. This muscle originates from the central inner surface of the mandible, inside the mandible here, and insert into the under surface of tongue and hyoid bone. It protracts or protrudes the tongue. Styloglossus. This muscle originates from the styloid process of temporal bone and insert into side and under surface of the tongue. It retracts, means draw posteriorly and elevates the tongue. Palatoglossus. This muscle originates from the anterior surface of soft palate and insert into the side of tongue. It elevates posterior portion of the tongue and draw soft palate down towards the tongue. Hypoglossus. This muscle originates from greater horn and body of the hyoid bone and insert into side of the tongue. It depresses the tongue and draws down and its side. Genioclosus, styloglossus, palatoglossus and hypoglossus, all these muscles are innervated by 12th cranial nerve. Digastric. This muscle originates as having two bellies. Anterior belly arises from the mandible and posterior belly arises from the temporal bone. So here this one is anterior belly and this one is posterior belly. Okay, and insert into the hyoid bone. This one is hyoid bone. It elevates hyoid bone and depresses the mandible, and it is again supplied by fifth cranial nerve. Sternohyoid. This muscle originates from styloid process of temporal bone and insert into the body of hyoid bone. It elevates hyoid bone and draw it posteriorly. It is also innervated by seventh cranial nerve. Mylohyoid. This muscle originates from inner surface of the mandible and insert into body of hyoid bone. It elevates the hyoid bone and depresses mandible. It is innervated by fifth cranial nerve. Genioclosus. This muscle originates from the inner surface of mandible and insert into body of hyoid bone. It elevates the hyoid bone and depresses the mandible and draws the tongue and hyoid bone anteriorly. It is innervated by C1 spinal nerve. Omohyoid. This muscle originates from superior border of the scapula and insert into body of hyoid bone. It depresses the hyoid bone and it is innervated by C1 to C3 spinal nerves. Sternohyoid. This muscle originates from medial end of the clavicle bone and manubrium of the sternum and insert into body of hyoid bone. It depresses the hyoid bone and it is supplied by C1 to C3 spinal nerves. Sternothyroid. This muscle originates from manubrium of the sternum and insert into the thyroid cartilage of larynx. It depresses the thyroid cartilage of the larynx and it is innervated by C1 to C3 spinal nerves. Thyrohyoid. This muscle originates from the thyroid cartilage of the larynx and insert into greater horn of the hyoid bone. It elevates thyroid cartilage of the larynx and depresses the hyoid bone. It is innervated by C1 and C2 spinal nerves. Sternocliedomastoid. This muscle originates from the sternum and clavicle and insert into mastoid process of the temporal bone. It rotates like this and flexes the head to opposite side. So this is sternocleidomastoid here. If this side sternocleidomastoid contracts, then head moves towards opposite side. So in this flexes towards the opposite side. These muscle flexes the neck when they work together in this way, and it is innervated by 11th cranial nerve. Semispinalis capitis. This muscle originates from the transverse process of first 6 thoracic vertebra and 7th cervical vertebra and articular process of 4th, 5th and 6th cervical vertebra and insert into occipital bone between superior and inferior nuchal lines. It rotates the head to opposite side when work alone, and when they work together, they extend the neck. They are innervated by cervical spinal nerve. So here you can see these are the semispinal muscles. This is the origin up to this level, and they insert into the occipital bone. Splenius capitis. This muscle originates from the spinous process of 7th cervical vertebra and first 3 or 4 thoracic vertebra and inserted into occipital bone and mastoid process of the temporal bone. It rotates in this way and laterally flexes head to same side when work alone, and they extend the neck when they work together, both side muscles. These muscles are innervated by cervical spinal nerves. Longissimus capitis. This muscle originates from the transverse process of upper 4 thoracic vertebra and articular process of lower 4 cervical vertebra and insert into mastoid process of temporal bone. It rotates and laterally flexes the head to same side when work together, when work alone, and when they work together, they extend the neck. These muscles are innervated by cervical spinal nerves. Scalene muscles. There are 3 paired muscles in the neck known as anterior scalene, middle scalene, and posterior scalene. Anterior scalene muscle originates from the anterior tubercle of transverse process of cervical vertebra C3 to C6 and insert into scalene tubercle of the first rib. Middle scalene originates from the posterior tubercle of transverse process of C2 to C7 cervical vertebrae and insert into upper surface of first rib. Posterior scalene originates from the posterior tubercle of transverse process of C5 to C7 cervical vertebra and insert into lateral surface of second rib. These all muscles, they rotate and flexes the neck. They also act as accessory muscle of inspiration during respiration, and these muscles are innervated by cervical spinal nerves, that is brachial plexus. So here you can see scalene muscles of both sides around the neck. This is the anterior scalene, this is posterior scalene, and this is middle scalene. Thank you students. For more such videos you can subscribe the channel, you can like Facebook page for latest updates, and for making your notes you can visit mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice day.